All right, hi everybody. My name is Caitlin Comet and my pronouns are she, her, and I will be one of your facilitators today. I'm a program coordinator at The Hub. We are the state designated regional behavioral health action organization, or RBHAO, for Region 1 of Southwestern Connecticut. Aside from The Hub, I'm also an adjunct lecturer at John Jay College of Criminal Justice in New York City, as well as a summer high school youth facilitator for at-risk high school students, and we talk about mental health and wellness. I'm very grateful to be here today. It's been many, many years in my experience teaching this topic in many different variations, trainings, workshops, lessons around the LGBTQIA+ community. And this work is incredibly important to me personally and professionally, being a part of the LGBTQ community. So I'm very grateful for Lisa and Jen and our other fellow speakers who are here today, Cadence and Ace. And all of the work that we're doing together to bring this series to you. So thank you for joining us.
And for the sake of recording, I'll reintroduce myself. I'm Lisa Mason, and I'm with TTASC, the Training and Technical Assistance Service Center. And we provide workforce development and prevention workforce development and support community-based coalitions. And I'm also delighted to be able to bring together a cadre of people to provide this training. Because this LGBTQIA plus youth has been identified by many coalitions as a priority population that they are seeking to support. So this fits in line with a lot of the work that our folks are doing. So I'm delighted to be here. And we are recording this training. We will provide a link to the training if you'd like to reference it or share it. And we will also send prevention slides the presentation slides, a resource list, and we'll also ask you to complete a very brief Google survey at the end. And then we will have part 2 next week, and we can talk about that more. So I'm going to share my screen, and Caitlin, I think you're up next.
Thank you, Lisa. See, you can stay on this slide actually just for a moment.
Sure.
So that we can just start off right away with a little bit of foundational information and asking ourselves, what does LGBTQIA+ stand for? And that stands for lesbian, gay, bisexual, transgender, queer, or questioning, intersex, asexual, and the plus is to represent more identities within the community. So you may have heard many different variations of this acronym, and we have decided to use this one, and you will see us continue to use this acronym for the remaining of our presentation, because we do feel that it is more of the more inclusive acronyms of different identities that make up this community. So we'll all be learning a lot more of introduction and foundations today. And then just a little note, I did want to say happy LGBTQ History Month. As we all know, many of us here, history is incredibly important, especially for the LGBTQIA+ community, as we have gone through quite a lot, still going through quite a lot today. So I just wanted to recognize that in our space and say again that I'm very grateful that we are all able to have these discussions and trainings today, and I'm very excited to continue with our presentation. So thanks everyone for joining us. Okay, so as a team, we have purpose in the work that we do, especially for the LGBTQIA+ community or other at-risk and specialized populations. And I do believe that everyone who's here today wants to do better and be better in the work that we do, and we can do that all together. So everyone who is here today, I would just ask you to ask yourselves, why is this important to you and the work that you do? And maybe you're a loved one or a friend or a family member, and in that case, ask yourself, why is this important to me or this person in my life who identifies as LGBTQIA+. And I'll just walk us through our purpose, which is firstly to inform and educate our region, or I should say in this state, what is happening in the LGBTQIA+ community and how we can help. We want to affirm and support the lives of LGBTQIA+ individuals, create brave spaces for all individuals. And for this one, I'm sure most of us have heard safe spaces before in language. we use Brave Space here, or is this something that I've been used to in my trainings and workshops? Because we cannot always guarantee to make a safe or to make a space safe for individuals. We can't always guarantee safety for others. But what we can do is try our best to create inclusive and empowering brave spaces to at least allow other individuals that chance to work up towards feeling safe and included in different spaces. So while we can't guarantee safe spaces, what we can do is create spaces in which we can work towards that for all individuals. And similar to that, we want to create inclusivity where we can in our spaces, personal, professional, in our paperwork, our policies, language, and more. We want to inform and empower advocates and allies, so individuals who are not within the LGBTQ community, being able to inform and empower all of you to empower us in return, and to create movement in supporting at-risk populations, which, as Lisa has mentioned, throughout the state and all of the regions of Connecticut, we have identified the LGBTQIA+ community as a community with additional barriers and challenges and at risk, in quotations, to not being able to receive the access of care and services needed in the behavioral health spectrum of many different challenges and areas. Oh, Lisa, you're muted.
That was embarrassing. But I'll survive. Learning objectives, participants we're going to learn terms and have a common language, common welcoming affirmative language that we can be using to provide those brave spaces. We're going to share some data specific to this population, both at the national and the Connecticut level. And I know some of you are beginning to collect it at the local level as well. Understand risk and protective factors for alcohol, tobacco, and other drug use in general, but also specific to this population. Identify some common community challenges that result in the risk factors. Learn about some evidence-based prevention strategies and how to build the LGBTQIA community into the strategic prevention framework. So basically understanding that it's an at-risk population and how do we make sure it's included in each step of the SPIF. So those are our learning objectives.
So in this work that we do, it is helpful to have group check-ins and agreements, and this is just to further create that brave space where we can create that space even in Zoom, and have a way to agree on creating a respectful and educational environment. So we have some group agreements here, and these are open to add or edit, and if anyone has anything to comment on or question, we welcome that at any time. So firstly, what is shared here stays here, and what is learned here leaves with us. So there may be times in which someone will share a story here, whether that's professional or personal, and that's okay. And we can, that can really enhance our educational experience for the next hour and a half. However, we want to respect each other's privacy. So whatever is shared here should stay here, and we want to avoid identifying information outside of our space. But what we learn from each other and those stories that can enhance our journey, that is what's going to leave with us. It's okay to say, I don't know. There's going to be a lot of information and terms and such that we're going to talk about. And it is more than okay to remain open-minded and say, I don't know what that is. And there's no shame in saying that. So we welcome questions and we welcome comments at any time. We are here to educate, not debate. So please keep those comments to yourselves. We are here to keep an open mind and listen to one another. Be respectful to all. If you are sharing, we ask that you avoid outing individuals. So talking about sharing, if you would like to share something that connects with this work, please avoid outing anybody. So that includes using someone's name or identifying information when you are sharing their story. And also, if that person did not give you consent to share their story, please be respectful and refrain from sharing their story. There are ways that we can make comments and questions that are still mindful and does avoid outing others. We all want to commit to language change and recognize that language is always evolving. And we're going to talk a lot more about language towards the end of our presentation. And please stay engaged. So we do welcome you to turn on your cameras, use your microphone, use the chat, or use reactions throughout our presentation. If you have any questions, feel free to use the hand raise emoji or come off of mute. And we welcome questions and comments throughout the presentation.
Culture is humility. Okay, cultural humility. We'll try that again. Many of us have heard of the term cultural competency. And the term that we're going to be using here instead is cultural humility. And some of the things to really emphasize about cultural humility is knowing that you don't know, that you will never know everything about another culture, and that you are committed to a lifelong process that requires self-examination, critique, and refinement. It's basically looking at what don't I know about this culture, and am I eager to learn, and what kinds of questions can I ask so I can learn more and do better. And one of the things that comes from this term comes from the nursing profession. And one of the things is the third bullet, redress or make right the power imbalances in the provider-client dynamic, or you could say in the majority-minority dynamic as well. Develop mutually beneficial, paternalistic partnerships with communities. And I think that applies to those of us doing coalition work or working with young people as well. Providing providers or organizations, prevention professionals remain open to learning and understanding and accept that we can never truly be competent in another person's culture, that it's a quest to learn more and challenging ourselves in assuming that our norms are not always valued by other people, or the majority is not held by everyone else. So really challenging ourselves and identifying what may be a personal norm and what are norms for other groups, other cultures as well. And you all being here is showing that sign of cultural humility by learning more. So thank you.
All right. So we're going to begin our basics, our foundational knowledge of sex, gender, and sexual orientation. And it's important to discuss these topics when we are talking about the LGBTQIA+ community, because it will help us to better understand different identities, but also it will help us to challenge assumptions. So what do I mean by assumptions? Well, when it comes to these topics, sex, gender, sexual orientation, these are all culturally bounded and defined by society in many different ways. So for example, we all assumed sex based on genitalia, and then we assume gender based on someone's appearance or their behavior, or even just gender roles in general is something that we are all very used to having conversations around and even feeling within our lives. We assume sexual orientation based on gender. So there's a lot of assumptions that happen around these aspects of identity. So if we want to truly understand a community, we have to understand the foundation of identities. If we want to be true allies and be effective in our work, we want to break down those assumptions. So I'm going to walk you through a little bit of what we mean by assumptions and the binary system. Next slide, please. Okay. So when we are talking about sex, gender, and sexual orientation, we know that, again, that these concepts are created by a culture. Things like gender norms or gender roles comes from cultural messages, comes from our society telling us how we should act and how we should behave and even who we should love. So these expectations, these assumptions are constantly placed on us, and because we're so used to it, we ourselves might even do this work. But part of our cultural humility, part of becoming advocates and understanding different communities is really challenging those assumptions and unlearning those biases or those, again, those expectations that we have of others. So that way of thinking, you know, male, female, masculine, feminine, women, men, is a binary. When we're talking about someone who is assigned male at birth based on sex characteristics, we expect them to act masculine and we expect them to be attracted to women. Vice versa, if someone is assigned female at birth, we expect them to act feminine in the way that they identify and express their gender, and we expect them to be attracted to men. So this is what we call that binary. This is a binary world of social norms and assumptions and expectations. So it really means one or the other, right? We're very used to two strict classifications of sex, gender, and sexual orientation, masculine and feminine. So this is a visual of how the binary operates. And again, it's all about assumptions and expectations. And what we're trying to do is break down this binary. When we learn to do that, we are better able to understand the LGBTQIA+ community and become more powerful advocates and allies in the work that we do professionally or personally. So sometimes this binary mindset is so strong that even right away, right at birth, when we are born, there's already expectations that are placed on us, how we should identify, how we should behave, act, or dress, and who we should love. And it's something that we're so used to talking about, we're so used to thinking about. It's so strongly embedded in our culture, but it's all false. These are all just concepts. Again, part of what we want to do is challenge the way that we might have been thinking for so long and break those assumptions. When we think about a binary world, especially in the LGBTQIA+ community, it's almost a system of oppression. So it is placing people in categories and wanting to assume and expect people to act and behave a certain way. And so it really does perpetuate strong cultural and societal beliefs that there's only two genders and two ways of attraction, which we know that to be false. So we're going to walk you through sex, gender, and sexual orientation and teach you how to see these concepts and see these experiences, not as a binary, but more of a spectrum. Next slide, please. So we're going to start off with sex. So sex includes genetics, genitalia, primary sex characteristics, secondary sex characteristics. When we are born, doctors take a look at our sex characteristics and assign a gender at birth based on those sex characteristics. So we understand sex characteristics as male, female, or intersex. Intersex is an umbrella term to describe a wide range of natural body variations that might not specifically fit into male or female assumptions of biology. So again, we take a sort of checklist of what kind of biology are we seeing when we're born, and we assign a gender based on that. Intersex may be someone that might have a variation of both female and male characteristics or biology. And it often then becomes a decision of the parents or the doctor to perform a surgery to correct, and I'm putting quotations around correct the biology and assign one gender. You may have heard the term hermaphrodite in the past used to describe intersex, and this is an outdated and inaccurate term that is no longer being used. You'll also see our acronyms on the left, AFAB or AMAB. So AFAB meaning assigned female at birth, and AMAB meaning assigned male at birth. So we want to use more inclusive language. Using something like AFAB and AMAB is really helpful because sometimes individuals don't always identify with the gender that was assigned to them at birth. But we know in paperwork and policies and such, sometimes that information is needed. So to be a little bit more inclusive, that is some language that we can use. So that's what we can understand about sex. It's broken down really simple. Again, we take a look at the sex characteristics and we assign a gender based on those characteristics. So now talking about gender, we know this to be social, psychological, and emotional traits, and it can be broken down into gender identity, or the way that we understand and connect with our inner self, and our gender expression, so physical characteristics, behaviors, and presentation, how we express ourselves. So gender, as we've spoken about, is influenced by social expectations. So there's a lot of expectations, you know, when we are assigned female at birth to act feminine and to be attracted to men. And again, that's that binary that we want to challenge. So again, instead of seeing gender as that binary, one or the other have to act a specific way, we want to understand gender more as a spectrum. Gender can be a mix of masculinity, femininity, both, or even neither. And so you'll see here that we did include some examples of different identities. Before we get into those identities in different terms, I would like to say that our goal is not to sit down and teach you all of the definitions to all of the terms and all of the identities. Otherwise, we'd be here for a really long time. There are a lot of great resources out there that can easily help you with this. And we did include one of those links, the UC Davis educational website that has a lot of great information, including a glossary. So there is an LGBTQ resource center that is free and available to everybody. So there's going to be a lot of terms, a lot of language that we just don't know, and that's okay. But that's why we utilize our resources available to us to help us. So I'll just go through these terms very briefly. But when we're talking about gender, these are some of the terms you may hear. For example, cisgender. So that is when your gender identity and expression matches with your assigned gender at birth. For someone like me, I'm cisgender. I'm a cisgender woman. I was assigned female at birth. I identify as a woman. I express typically as feminine and as a woman, and that's how I would identify. There's also individuals who may identify as transgender, where your gender identity does not align with your gender assigned at birth. So you may have heard an individual who's a trans man or a trans woman. There's other identities such as genderqueer or gender fluid, which can mean that your identity does not align with that binary. Remember that one or the other, man or woman, and instead may be a mix of both, maybe a mix of feminine and masculine. Non-binary, non-conforming, these are other identities where an individual may not align with either, may not align with the gender expression of man or woman, masculine or feminine, and may align outside of that binary. And similar, agender is an identity that falls within that non-binary umbrella and may describe someone who does not identify with any gender or has a neutral gender. So again, I know a lot of terms and language. We often hear that this can feel overwhelming. However, if we're going to talk about understanding and respecting another person's identity, especially within the LGBTQIA+ community, this can be life-saving. Our actions and the way that we accept others and respect others is incredibly important, especially in this community. So it might seem like a lot to learn, but it's all for a reason and has a purpose. And again, there are different tools to help you. Or we're also going to talk about how you can be an ally and learn from others and how to have a conversation, how to host brave spaces so that you can learn from others. There are many different identities because we all identify differently. While we may have similar experiences, it doesn't mean we're all the same. So that there is purpose to all the different identities, and that is okay. So we talked about sex and how we are assigned the gender at birth, and we talked about gender, and this is how we identify within ourselves, and we also express our ways differently. So again, trying to move away from either expressing yourself as masculine or feminine, and more so seeing it as a spectrum, a mix of both or neither. Okay. So sexual orientation is also something that is heavily influenced by our society and culture. And based on our gender or even just how we behave, a lot of people create assumptions of who we should love or be attracted to. And when we're talking about sexual orientation, essentially who we are sexually attracted to or not, it's also important to talk about emotional and romantic orientation, which is actually separate from our sexual orientation and is more so our emotional and romantic attraction. So again, instead of seeing even sexual orientation as that binary, again, loving or being attracted only to men or only to women, we want to instead move away from that and see sexual orientation as that spectrum. Same goes for emotional and romantic attraction. And we've talked a lot about identities so far. And again, there's a lot of terms, there's a lot of definitions. But when it comes to anyone who wants to identify a specific way, it is completely up to them and within their power to identify and use whatever terms they want to use. So long as those terms or those identities are meaningful to them, we want to be respectful of that. For example, lesbian might be referred to an individual who identifies as a woman and is also attracted to other women. However, someone who may identify as non-binary and does not identify as a man or woman may also identify as a lesbian if they so wish and if they feel like it captures their sexual orientation the best. So we've spoken about sex and we have a gender assigned to us based on sex characteristics, our gender, how we connect with our inner selves, how we identify and how we express ourselves, and then our sexual orientation, so who we are sexually attracted to or have an emotional romantic attraction to. And so I'll quickly go through these terms again, but again, there are many different resources out there to help you to understand the difference between these definitions and identities. So we spoke about lesbian. Gay is usually someone who identifies as a man and is attracted to other men. Bisexual, someone who may be attracted to both men and women. Pansexual, someone who is attracted to others, regardless of gender identity, other individuals. Many of you have heard the term queer, and for many, we can understand this as an umbrella term that can mean just any sort of celebration of not fitting into any norms. So someone who identifies as queer would be someone who might identify within the community and just doesn't want to identify within those norms or the binary. And what's important about this term also is that historically, queer has been used as a derogatory term. Today, the LGBTQIA+ community is sort of trying to reclaim that word, take back the power, and use it in a positive and inclusive way. And typically, only those within the LGBTQIA+ community use the term. There's also questioning, so someone who may be questioning a part of their identity. Asexual or ace is someone who may not particularly feel sexual attraction to someone, but can still feel emotional or romantic attraction to other individuals. Demisexual is someone who may need an emotional or romantic connection with others in order to feel sexual attraction to others. And then we have heterosexual, so someone who is attracted to a gender opposite or other than their own. So again, I know we sort of quickly rushed through different terms and definitions. Again, there's resources out there to help you, but we really just wanted to break down these 3 different areas of identity. And if we can go to the next slide. So this is a really wonderful image and visual from Triangle Community Center that breaks down that binary. So remember that visual we saw towards the beginning before we got into sex, gender, and sexual orientation. So this is a much more inclusive visual that includes that spectrum of gender identity, gender expression, sex assigned at birth, physical, sexual attraction, emotional, and romantic attraction. So again, that visual we saw earlier was very much one or the other, one end of the spectrum or the other, man or woman, masculine or feminine. Again, we're moving away from that and instead seeing everything as a spectrum, which will help us to challenge our assumptions that we may have and our expectations that we may have. So, and it helps us to be inclusive because there are varying degrees and levels of identity. So you'll see instead of, the 2 dots that we had earlier, you'll see the arrows that indicate that spectrum. So how can we know how to ask someone how they identify? How can we best have that conversation or create a space where someone feels comfortable to discuss their identity? There's a lot of different questions I'm sure we all have. And that's where I'll just put a little shout out that we will have our part 2 of the series where we are going to talk more about how to answer those questions, and that part of our series of allyship and inclusivity. But again, now you have the basics, the very, very basics of identities, and you will then be able to learn how to apply that into your allyship and your inclusivity, which will then you'll be able to apply into your work professionally or personally. So with those concepts that we have, we're now going to throw a lot of information and statistics at you. Next slide. You had it, Lisa. Yeah, thank you. So we do want to talk about the experience of LGBTQIA+ individuals and why this is important to know. So again, you're all going to receive the slides and the recording, so you can always come back to these statistics, but we're just going to highlight a few for now for the sake of time. So essentially, when looking at the most up-to-date statistics and experiences of what's happening in different LGBTQIA+ communities, we know that there are individuals who identify within this community in every state. We also know that many within this community are faced with serious mental illnesses and mental health challenges, including substance use disorder and suicidality, which is high in these communities. And that's compared to cisgender individuals or heterosexual counterparts. It's really important to know that just because you identify as LGBTQIA+ does not mean that that's the problem for all of the challenges that this community faces. So just because I identify as queer does not mean that everything that is a challenge is because I am queer. A lot of this is due to gaps in effective and inclusive treatment, accessibility to adequate care, individuals who are misinformed or not educated about the community and about different identities. Because of that and more, and we'll talk about risk factors, it creates more challenges for individuals within this community that then in turn can affect our mental health and our experiences. So we know that we're everywhere, and we also have a lot of extra challenges that we face. Also, in particular, BIPOC, LGBTQIA+ individuals or Black, Indigenous, people of color, individuals within this community face significantly more barriers in mental health and access to care compared to their white LGBTQIA+ counterparts. Also, trans individuals also face significant barriers compared to cisgender individuals. And we'll talk about those risk factors and challenges in a few moments. Again, these statistics are for adults, and now we're going to focus on youth. In the next slide, please. So what we're seeing in youth statistics reflects that of similar to adults. And again, you will get these numbers. I'll just highlight a few that are on here. So 42% of LGBTQIA+ youth have seriously considered attempting suicide in the past year, including more than half of that number being individuals who identify as transgender or non-binary. And this is really recent information and statistics that came out of the Trevor Project National Survey in 2021. 12% of white youth in the LGBTQIA+ community attempted suicide compared to 31% of Native or Indigenous youth, 21% of Black youth, 21% of multiracial youth, 18% of Latinx youth, and 12% of Asian Pacific Islander youth. So again, we see those numbers are so much more higher in BIPOC or Black, Indigenous, people of color communities within the LGBTQIA+ community. LGBTQ youth is specific to our state, according to the National School Climate Survey from 2019. Often hear anti-LGBTQ remarks in schools, mostly hearing gay in a negative way. For example, "That's so gay." 57% of LGBTQ youth have reported experiencing verbal harassment based on their sexual orientation, followed closely by their gender expression and gender. And 20% have experienced physical harassment based on their sexual orientation. So we see a lot of bullying happen, we see a lot of barriers, and we see a lot of misrepresentation happening within the community. The next slide is a continuation of some statistics from the Human Rights Campaign. Again, very recent numbers. Again, I'll just sort of point out a few here, but you will receive all of the numbers. 24% of LGBTQ youth, including 35% of transgender youth and 41% of questioning youth, have skipped school because they felt unsafe at their own school, compared to 8% of non-LGBTQ youth. 22% of LGBTQ youth, 29% of transgender youth, and 32% of questioning youth, and 27% of LGBTQ youth of color have attempted suicide, compared to 5% of non-LGBTQ youth. We also see some statistics in substance use. In particular, LGBTQ youth of color have tried smoking electronic vapor products compared to a much lower number of non-LGBTQ youth. LGBTQ youth of color are currently using alcohol at higher rates than non-LGBTQ youth, as well as other substances that LGBTQ youth have reported experimenting with or using, including cocaine, inhalants, heroin, meth, ecstasy, or steroids. So continuing with the statistics, this is an infographic that further highlights the challenges of LGBTQIA youth experiences specific to our state when it comes to substance use, bullying and harassment, and mental health. So it's a little small on my screen, but if you can see, LGBTQ, lesbian, gay, or bisexual population is seen here with the darker blue color, which is higher in all of the substances, trying to see, sorry, including cigarettes, e-cigarettes, marijuana, alcohol, and prescription medication. So as we can see, LGBTQ youth are just using substances at higher rates compared to non-LGBTQ youth. And what we're seeing in bullying is, again, higher rates of electronic bullying or bullying through social media, bullying at school, feeling unsafe at school, forced to have sex. So we see a lot of assault also happening and violence happening. And then when it comes to mental health, again, we just see that the darker blue color is much higher, feeling sad or hopeless, considering suicide and attempting suicide. And what is really alarming when we're talking about statistics in general when it comes to the LGBTQIA+ community, it's really tricky to properly represent and capture statistics within this community. So whenever we're talking about numbers, we can only assume that numbers are actually higher than what we're seeing, because again, it's hard to accurately capture the experience of the community. And this infographic, I appreciate, highlights one of those barriers. The fact that it is only recently that surveys are asking about sexual orientation or gender identification. So I know it's a lot of numbers, they're sobering numbers, but it is really important to know what individuals in the LGBTQIA+ community have to face so we can better understand their experiences, our experiences. When we do this, we can become effective allies, we can empower the community, we can challenge and change the systems to improve lives, and we can become more empathetic and respectful, all of which this is all needed. We need more of this in our world. So now I'm going to go into some risk factors And there's a lot of risk factors, but again, please remember that being part of the LGBTQIA plus community, identifying within this community is not a risk factor within itself. You are not mentally ill just because you are gay. There are risk factors that come because of the community challenges that this community may face. So I'm going to go through the all of these here. But the need for safety. So again, we talk about, we want to create safe spaces, but we can't always guarantee it. And there are some spaces that are just not safe for individuals within the community. We see a lot of homophobia, transphobia, microaggressions, which are subtle, harmful ways of showing our bias or showing our stereotypes. Bullying and harassment, which we saw in those numbers, and violence and assault, again, which we saw in those numbers. So there is a need for safety for individuals within this community, but it's not always guaranteed. And there are some spaces that are much more unsafe than others. A concealed identity. So not only do we have to, face the outside world, but also in personal lives, this concept of being in the closet or concealing our identity, not quite out with our identity, not telling others how we identify or who we love or our attractions, who we feel within our inner selves. There's a cost to coming out because you are then put into different situations where your safety needs to be guaranteed, but it's not. So many individuals may conceal their identity because of the need for safety, which you might hear referred to as in the closet. And then the continuum of coming out. So coming out is a huge process, which we'll talk a lot more about in our session 2, our part 2. But there's also the risk of someone outing you without your consent and disrespecting your privacy and your identity. And now you are being outed for an aspect of your identity, which might put you into a place that is unsafe. So there's a whole lot of experiences that come with concealing your identity and coming out, which again, we'll talk more about in part 2. Within the LGBTQIA plus community, we also see high numbers of homelessness and job loss and discrimination. There's laws and policies that are against LGBTQIA plus individuals. Inequity and incarceration rates are high as well. And you can really just imagine a story of someone who may identify within the community that may have been outed, that is going through a lot of unsafe experiences, and because of that may experience homelessness, job loss, discrimination, or incarceration. The fact that, in some states we can't even say the word gay because that's how strong these biases and assumptions are, that only recently are there now marriage laws around LGBTQIA plus communities. These are all things that still affect us to this day and that will continue to affect us. Other risk factors, if disrespect and no recognition, invalidation, names and pronouns. So if someone can't respect your name and can't respect their pronouns, it's really harmful to an individual who just wants to be respected, who just wants to be called by their name and their chosen pronouns or their pronouns. We also see a lack of representation, expected or perceived rejection. So again, that, sort of fear of our own safety may come with our expected rejection from others or perceived rejection from others. There's also internalized homophobia, transphobia, and shame. There's a lot of individuals that might feel shame for how they identify because of, again, these cultural expectations and assumptions that are placed on us. Family, friends, community, loved ones that are disapproving, difficulties finding and maintaining a support system, trauma in general, interpersonal, treatment, history, mental health, substance use disorder. Inadequate behavioral health care and distrust in care professionals or providers, and a lack of representation in these systems. So when we don't feel safe to get treatment or to open up to someone, and that could be, that access to care component there, then we're less likely to receive the treatment that we need, which may lead to many other challenges and risk factors that happen. So it really just trickles down, and it can be sort of the rock that's falling down the mountain, and it's just creating a cascade of challenges. Pretty poor example, but I hope you can see the story that I'm trying to create here. There's also some other specifics that risk factors for substance use disorder, including low perception of risk or low perception of peer disapproval, low perception of parent disapproval, poor parental monitoring, a family history of substance use, social and retail access, so when it's more easily obtainable to get access to substances than it is to adequate treatment or behavioral health care, lack of school connection, low academic achievement, childhood sexual abuse, mental health issues, a lot of different risk factors that can contribute to that substance use disorder piece. And again, we spoke about how BIPOC LGBTQIA+ individuals face significantly more challenges, as well as trans individuals face significantly more challenges compared to their cisgender or white counterparts. So many of these risk factors might be happening for the whole LGBTQIA+ community, but we can't ignore the fact that for BIPOC individuals and trans individuals, there's more challenges that come with this. So effective prevention strategies that Lisa is going to walk us through in just a moment target these risk factors, and we do use local data to identify and prioritize which risk factors to target.
Thank you very much, Caitlin. And so now we're going to shift gears a little bit and talk about protective factors. What are some of the things that really make a difference in terms of the mental health of young people and the LGBTQIA community and help to prevent substance use. And one of the things we do in prevention is we try to identify those risk and protective factors that are specific to our local community, but also specific to different subgroups of young people that we may be concerned about. And some of the things that we found that research has shown that have proven protective factors and things we want to enhance or strengthen is supportive family, chosen family, or social circle. And we know one of the most important things for young people is having a supportive family, a family who accepts them as they are, and who wants to know more, wants to meet their friends, invites their friends to places and checks in with them. And also providing them the space, the opportunity to create a chosen family, being able to find people who they can identify with, young people, adult models, but people they can be comfortable with, finding my tribe, as one young person explained to me, and creating that social circle where I can be brave because I feel safe. And representation, having people, whether it's in books or movies, or teachers or adult advisors or coaches who are similar to me, so I can see myself, and I can see myself as an adult being successful as well. School engagement is a huge one, and it's not only academically, but I feel safe there, and I feel valued, and my school is a welcoming, supportive, inclusive place. Are there adults who use my name, my chosen name, if that's the one I prefer to use? Are they using the correct pronouns that I have chosen for myself? So respecting those names and pronouns. And not only schools, but having community centers, workplaces, spaces, where they are welcomed and affirmed. And then developing a healthy sense of self-worth and self-appreciation, developing that identity, but also being able to find things I'm good at, skills that I have, things that I can pursue, and finding outlets to explore those. And then another protective factor is the whole idea of, oops, oh my goodness. there we are, is finding affirming services, whether that's mental health or physical health, dental, whatever. But just finding places that are going to be affirming to me, that are welcoming, that accept me, that are comfortable using my my chosen name and pronouns, and check in with me about other questions that may be pertinent to my status as a member of the LGBTQ community. Like, do you feel comfortable? Is there a restroom, a non-gender restroom that you can use at your school? Do you feel comfortable going to your guidance counselor? Or is there another adult? So asking questions like that, as well as cultural competent services and resources. And please, Caitlin, and other folks who are here, if you have stories or examples to illustrate, please unmute yourself and jump in. I would appreciate it. So we're going to talk about some prevention strategies based on those protective factors. And one of the things we know for all youth, when it comes to talking about alcohol and other drug abuse, and preventing substance misuse, is for parents especially, but adults, to discuss our expectations around their alcohol and drug use. As young people become older, like young adults, we may want to start talking about harm reduction if we know that they are using substances, but pretty much it's a given in the prevention field, especially with underage use, to discuss the expectation that we expect that they're not going to use, and that you can get to, 18, 21 without using substances. And what are the consequences for those? And young people tell us over and over again that please give us the facts and let us make our decisions. But we can tell them what our expectations are. One of the things I do in my own family is talk about brain health, and how substances impact the development of their brains. And I joke that I've invested 18 years in those beautiful brains, and I want those brains to be as good as they can be. And substances get in the way of that. And so my kids will actually say, yeah, Ma, we know, we're taking care of our brains. And so discussing the expectations and what are consequences for breaking those expectations. I had one colleague who told their daughter that if they ever caught them drinking and driving, they would no longer have access to the family vehicle ever, because they wouldn't risk it on their insurance. So that's what one family did. Another parent I know kept a drug test on top of the fridge. I told my kids I would not hesitate going to the pediatrician for a drug test if I suspected. So there's all different ways parents can do this. But the idea is that they're discussing the expectations for the young person and their family, and also monitoring where their kids are, who their friends are, what's going on. A really quick example, I have a son who's a skateboarder and a snowboarder, and there's a lot of marijuana or cannabis use in that population. So we've talked about what that would be like and how might he deal with those situations, and what could be the consequences if he was using while he was partaking in those activities. And then positive reinforcement is just reinforcing them not using and making healthy choices. Really reinforcing that for them. And one of the things the adolescent expert screening, brief intervention, and referral to treatment screening does is it reinforces kids who are not using, saying, we're glad to see you're making healthy choices and we'd like you to keep at that. So that positive reinforcement is really important. And not only positive reinforcement for not using, but positive reinforcement for their skills and their abilities and their talents as well, their contributions. And then for teens, all teens, but especially teens in the LGBTQIA community, providing that family support. We've talked about that. We know that families are the #1 reason that teens who are not using substances report that they're not using. their parents have talked with them, their parents have expressed their expectations, their concerns. And so these young people say that their parents report have a high disapproval rating of them using substances. And that's one of the things a lot of surveys ask young people about. And so we see a definite correlation between young people who don't use and young people who report that their families have high levels of disapproval of use. Having caring adults who accept them as they are, and use the correct name and pronouns, and whether those adults are the extended family, teachers or advisors at school, advisors or staff in youth organizations or sports, and then safe schools. And I found it very interesting, Caitlin, when you presented the statistic about 8% of kids overall, heterosexual kids feel safe in school, and then the numbers were so much larger. And so it really got me thinking about when we see these statistics around safety in school, people will sort of be, really, we don't have guns in our school, or we don't have this in our school. Why is that? And so to take another look at that and dive deeper, into that particular statistic, and what does it mean for different subpopulations of kids. And then the whole idea of providing welcoming, affirming healthcare as well, and safe schools where kids feel safe and aren't being bullied or harassed, or what I call that stealth bullying, where nobody else sees it, nobody else witnesses it, which can be so hard because a young person might report that, but there's no witnesses, and the school says, well, we can't corroborate that. Very frustrating. Okay. For prevention professionals, building the LGBTQIA community into the SPIF. As many of you know who are actively engaged in the prevention field, and for those of you who are new to prevention, we follow something called the Strategic Prevention Framework, or the SPIF, SPF. And it's a 5-step public health planning model that we use. And there's 5 steps. It starts at the top with red, assessment. We want to know what the issue is. Who is the target population we're working with? What are the priority substances? What are the priority risk and protective factors? So we collect data and we make decisions based on the local data that we have. And while we're doing that, we're building capacity. We may be building a local coalition or educating the community about the different issues that we're trying to prevent, and building community support. And then planning is basically coming up with a plan that's going to target those risk and protective factors, reduce risk factors, enhance protective factors that we've identified using evidence-based prevention strategies that have been proven to work and that we think are going to work in our community, that we have the ability to do. Either with support or we have partners, and then implementing it, that plan, actually conducting those prevention services, and then evaluating it to see how we're doing and whether we have to change things to get the results. Are we getting the results that we had hoped for? So that's basically a quick review of the SPIF. And there's ways that we can bring in, this is just a more detailed version of the SPIF, and it talks about the different tasks that we need to do. And one of the things for us to think about is, how do we address the needs of the LGBTQIA plus community within each of these steps? So for assessment, are we asking questions on our youth survey about kids' status? So we can look for correlations in the data. Are we asking questions about being safe at school, for example, and their substance use? building coalition capacity. If we decide that's a subpopulation that we want to look with, do we need to educate our coalition members or our community members about the fact that they're at higher risk? And what does the data in our community say? And planning, do we need to adapt some of the prevention strategies? Do we want to bring some members of the LGBTQIA community, either teens or adults, in and take a look at some of the strategies and activities we intend to do and say, does that resonate with you? Or do we need to change our messaging? And the same thing with implementation and evaluation. So those are just some ideas. And here's some additional prevention professional strategies that we can be talking about, and use of targeted LGBTQIA messaging and social norm campaigns. Social norm campaigns are basically advertising campaigns that we're directing to young people or parents or the larger community. And we're basically educating them, providing them some facts, but also asking them to make a behavior change, take on a new behavior, a call to action. And sometimes we're actually sharing statistics or data to dispel myths. So for example, in my community, an example might be that the number of young people who identified themselves as belonging to the LGBTQIA community in my community from our school survey doubled in 2 years. So, you know, is that something that teachers should know? Is that something providers in community organizations, parents should know? So that's an example of changing norms. Providing education and awareness trainings in our community, and asking providers who have experience working with the population or members of the population. And we're doing that, you know, in this training series, promoting affirming healthcare and mental health resources and checking on them, doing sort of a quality control list, you know, when we have a list of asking those questions before we connect young people with them. Offering QPR, which is question, persuade, refer. It's a suicide prevention, gatekeeper prevention training, youth mental health first aid trainings to people in the community, and talking about how members of this subpopulation are at higher risk for both mental health and substance misuse. Again, not because of who they are, but because of the discrimination and harassment and lack of safety and discrimination that they're subjected to. Conducting focus groups and key informative interviews with people who can give us more information as we're collecting data, including these questions in our surveys. Caitlin has already said this earlier, and she's going to talk about it again later. Just being aware of the terms and the languages that we use in discussion and messaging, and asking young people, what are the terms they prefer? And as I asked a young person recently, who identifies as non-binary, I said, what does that mean to you? Does that mean both male and female? Does that mean neither? And it allowed them to express what it meant to them. So I wasn't going in there with preconceived ideas. And avoid the use of youth as tokenism. And we have a chart on this side that starts at the bottom where we see youth as like a token, and really avoiding their input or not welcoming it, to being heard, to collaborating with adults and building youth leadership. And then it gives us, different levels of this ladder on what we can do to involve them. So it's a spectrum of youth engagement that we can use. And if you have additional questions, we'd be happy to answer this. I think it's pretty self-explanatory, and it really depends where the young people are. Young people, if they're just starting, unless they have an incredible sense of poise, may not be comfortable starting at the top of the ladder unless they've had other experiences to do that. So one of the things we remember from the social development model is not only do we need to provide meaningful opportunities for engaging young people, but we need to make sure they have the skill development and support to participate and be successful, and then provide them recognition for a job well done, to keep that cycle, reinforce that cycle. Okay. And then steps for educators and youth serving professionals. And we've talked about this already, but just creating an LGBTQIA affirming environment in schools or in the youth organization, the youth council that you work with. And, you know, whether that's providing a GSA, a gender, I know they have different terms, gender sexuality alliance. I think that's one definition. Caitlin, correct me if I'm wrong.
So the Gay Straight Alliance.
Or Gay Straight Alliance, yep. Thank you. Is, you know, whether there's a club like that that's available at a school or say a community organization, or there's a way to help young people connect with that, offering to be an advisor or a helper to that. Prevent and addressing bias and bullying, calling it out when you see it. We don't tolerate that. Helping young people be positive bystanders and call it out as well. So not just the adults, but the young people say, hey, we don't do that. That's not the norm of how we behave around here. And supporting youth directly by connecting with them, by calling them their chosen name, and then teaching about mental health and substance misuse for all populations as well. So those are some of the steps we can take. Steps for policymakers and advocates: oppose zero tolerance policies. And I believe what this means is recognizing, for a long time, back in the 90s, we had zero tolerance policies about kids who were using substances. And it was like, you're out of here when you use. And one of the things we know, especially with vaping, we've seen is that kids are vaping in school often because they want to, but also because they've become addicted. It's like, it's impossible for them to go 7 hours without, if they've become addicted. So looking at policies that provide consequences, but also help for them. How do we integrate those help and support, whether it's held at school or after school? So what several schools are doing now is they're providing young people who violate the vaping policy with a vaping education program, either held after school or during school. So that's one example. Oops, sorry about that. Okay, expanding services addressing LGBTQIA plus youth and homeless youth. And we know that this population is more likely to be homeless. They have a higher percentage of being homeless, and that can be because of family rejection, that their family has rejected them or they don't feel safe at home. And we know young people are at higher risk for substance use. LGBTQIA youth are at higher risk for substance use, using substances as a coping mechanism for the mental health issues brought on by bullying, prejudice, stigma, etc. But we also know that LGBTQIA homeless youth are also at a much higher percentage of substance use as well. And then another thing we can do is encourage policymakers and advocates to fund prevention-oriented research so we can learn more about the population and what are best practices and how we can help support them as they grow up to be successful adults and healthy adults. And I don't know if anybody wanted to add to these. I think it was, we're going to send you a list of one of the things we're going to send you is a resource list, and on it is the Family Acceptance Project, based, I think, out of San Francisco University, and they detail 55 things that families can do to support. And I've looked at that and I'm like, wow, that's a lot. So, and I'm sure a lot of those we can adapt as youth prevention professionals or clinical people as well, people working with youth. So I encourage you to take a look at that. And if I can find that, I will add it to the email that we will send you with all these materials.
Ace, I see your hand up.
Yeah, sorry to bring, there we go. I didn't want to, my light keeps flickering. I know you were talking about the policy making, and three very distinctive ones that I would have individuals review and look at, and I can also send in the chat. And I know that part two will probably be going over that with Cadence, Caitlin, and myself. But looking at like Act 11-55C in Connecticut, the House Bill 6599 that was passed in 2013 that specifically looks to reflect that an individual who is trans or non-binary has the ability to use the bathroom of their choice and how they identify, as well as it expands on a multitude of other different activities, different protections for those individuals and for those young individuals, as well as the Title IX Amendment of 1972. So those are key critical pieces within, yeah, definitely Cadence, that I would highly recommend people to look at those guidelines, those policies, because those are in place in Connecticut that don't allow individuals to sway out of, well, I'm not going to use that name for you. Or some teachers that I've worked with are unsure if they can reinforce that young kid's name that they're using in the classroom. And instead of a teacher or a staff member having to add a personal content of saying, well, we want to be inclusive and diverse, and this is how our school is, we want you to say that, yes, but we also are using these guidelines to make it inclusive and diverse. We're not just doing this, and oftentimes that kind of pauses that parent or that caregiver that is in opposition, where you're saying we are following the rules and the laws that are in place in Connecticut. And oftentimes that is what is that kind of bouncing point to bring about conversations, to bring about protections that don't lead you down these back and forth, well, I feel, well, you feel, well, I feel paths. These are the things that are in place. And I can put in the links. I know we will have them in part two, but kind of just to think about, especially moving forward with policies and protocols in place. But continue. Great work.
Thank
I
you,
just
Ace.
wanted to follow up on that really quick. Thank you, Ace, for bringing that up. It's my understanding that young people can ask to have their chosen name, not their legal name, used in school, and that parents don't have to be informed of that.
I that's something I was just going to jump in and say. That is honestly the number one thing I find myself having to tell educators and folks working in school. And it's funny, I always bring in other examples, right? Let's say you have a kid named William, and the very first day of class, he tells you he goes by Billy. You're going to call him Billy without even thinking about it. You're going to let him write it on all his assignments. It's just something you're not going to think about it. People tend to get so nervous when it's for gender affirming reasons, but I'm like, you do it all the time already. And you do not have to inform parents or guardians ever, no matter how old the child is.
And I have two just really quick stories on that. One is it's been fascinating watching a young person I know in that coming out process that you talked about, Caitlin, is a continuum. 1 year they said, could you email my teachers the preferred name? They asked the parent, and the parent did. And then the next year they said, I feel comfortable doing that myself. And then the following year, they actually changed the name on the records for the school. So everybody in the school was using that. So it was fascinating watching that process. And I'll keep the second one to myself. So I will stop. Caitlin?
No, please don't stop. If anyone else has any questions or comments, I wanted to use this time just to check in and give everyone a chance to put in the chat or get on the microphone if you do have any questions or comments, because we are nearing the end of our presentation. And thank you, Ace and Cadence, who are both going to join me next week for part 2 of our series. And we are going to cover the fundamentals of allyship, reviewing strategies for building inclusive environments, implementing practical strategies and best practices. We are going to talk about some specialized environments such as schools and treatment centers. We're going to talk about providers and policies, advocates, and I think that covered everything. And we are also going to hopefully make it more of a discussion approach and talk about lived experiences, and if anyone has any stories to share or questions to ask. So check in with the chat. Yes, I cannot agree more how important it is that we have these best practices in place to empower youth, especially because think about already the messages that they are receiving from the bias and expectations and assumptions and the pressure that youth have to face when it comes to all these different challenges in life, on top of normal everyday things that they have to also face. And something like just respecting someone's name and pronoun has actually been shown in research to be life-saving. That lowers the suicidality components of challenges that youth face just when they have their pronoun and name respected. And I have too many stories of students and colleagues and friends in which their names and pronouns were not respected. And it has to be a huge process just to get a teacher to call you by your name. So we'll talk about these more stories and lived experiences. I did see, so Lisa put the feedback survey in the chat, and then Emily has asked, do you have recommended resources for parents wanting to support LGBTQIA+ teens? Maybe Lisa, I can refer back to you. You were talking about those resources. I think we'll be able to send those out. Okay, great. So yes, Emily, we do have resources and we will send all of that out. There's so much that is online, and this is also something that we have created that we will share out, which is language, which again, we know can be a huge challenge for us to change the way we speak, to change the way we think, unlearn what is unhelpful and learn what is more helpful and empowering. And this is a little cheat sheet, I guess you can say, to help you. But please remember that language is so incredibly powerful. It really, the way that we speak to others can communicate our allyship, can communicate our respect and acceptance and empathy. So certain, small changes in language can be incredibly helpful, and with time and practice will become easier for us. It's also important to know that language changes constantly. Even in LGBTQIA+ research and education, we are constantly going back in there and changing something because we are now more aware and educated. And I can thank Cadence for helping me with one of those aspects in the slides, that we change something to become more inclusive and mindful. Know that it's okay to make mistakes, hold yourself accountable, learn, and keep trying. So even though I am part of the LGBTQIA+ community, I make mistakes as well. And I give the story of one of my best friends of 10 years was going through her transition, and she gave me the consent to share this story. And I was, learning pronouns and names and respecting her pronouns and names. And I made a mistake once, and we talked about it, and I apologized. I held myself accountable, made sure she was comfortable, made sure that she was okay. And we move forward. So it's okay to make mistakes so long as you are holding yourself accountable, you're learning, and you're trying always. And also note that a person within a community can identify however way they want. That is within their power. So we talked a little bit about that with different identities and names. Anyone within the community can identify how they want within, and that's within their power. Let's see what else. So I I don't know, I could go through all of these. I don't think we have to, but there are some that I do want to highlight just because of the many prevention professionals here. We've been talking about, preferred name, what's your chosen name and such. And in most spaces, we can just say name and pronouns. What is your name and pronouns? We don't have to talk about chosen name. We don't have to talk about dead names or anything like that. It is simply, what is your name and pronoun? How do you want to be called and referred to? I often hear individuals refer to a lifestyle, the queer lifestyle, the gay lifestyle, the LGBTQIA plus lifestyle. Instead of that, let's use lives, identities, and community. LGBTQIA plus community, individuals who identify as trans, etc. Chooses or choices. So we often hear, oh, this person chose to transition, this person chose to come out, this person chose to be gay, this person chose to be non-binary. This is not a choice. These are identities. These are our experiences. So a person, instead respecting that and referring to individuals who identify as, individuals who have come out, individuals who are accessing medical care. And then two more that I'll just highlight. Instead of saying that someone has fully transitioned, for example, a trans woman that has fully transitioned, please use has had this surgery, has not had that surgery, has had gender affirming care, is on hormones. And again, that's only if that information is relevant. If I have a student that comes up to me and says, hi, my name is this, my pronouns are that, I know it says differently on the page, I don't have to talk about their transitioning experience in any way. That's not relevant. For medical professionals or in certain areas of care, you might have to identify certain papers and policies, may need to identify certain aspects of an individual's identity to provide a better care, in which case you can still be mindful about your language and can still be respectful. Please instead, similar to that, instead of using sex change, using gender affirming surgery. And please know that for anyone who identifies as transgender, does not have to have surgery, does not have to be on hormones, does not have to dress or behave or act a certain way to be able to identify as transgender. And that goes for all of the other identities. Remember, assumptions and expectations are to be challenged, and instead spectrum and just getting to know who an individual is. I'll stop there. I see a few more things in the chat. Thank you, Ace, for putting those policies. If you haven't already, and thank you, David, please register for session 2 following that link in the chat. And Keaton has shared, I always joke it's like learning a language. The first day you learn the rules for how you do things, then the next day you come in and it's like, here's the 50 exceptions. Exactly. All right, so I'll stop here. I know I've talked a whole lot and we have about 5 minutes left. So Ace, Lisa, Cadence, if you have anything else to add, please do so. And if anyone has any questions, comments, or stories, we will stay here. But I did want to say thank you everyone for joining us today. It is so wonderful that we get to do this statewide, and thank you TTASC and Triangle Community Center and ACE for all of your work and help and support. I'm very grateful to be here with you all today.
Yes, thank you so much for joining us, and we'll stay here in case people have any questions, and we hope to see you on session 2 next Wednesday, and please do the survey.
Rebecca, I see your hand up.
Yes, quick question to follow up on the example of the student and teachers and the teachers using the name. I was just wondering about the rationale behind parents not needing to be informed. Is that kind of because, you know, the statistics show us that a lot of times parents disagree with the name and we want to protect the child, or can you give me some information about that so I can understand?
I can jump in and obviously other people have things to add. So absolutely, that what you just said is exactly it. A lot of the times a student will specifically say, my family will not be good to me if they know this is who I am and this is the name that I'm using. And that is specifically the reason why parents, guardians, caregivers don't need to be informed. Obviously, if they can be involved in the process, that's so much better for everybody. Absolutely, right? Like that is what we want. But sometimes that is not safe or in the best interest of the young person, which is just why it's never a requirement anywhere. In fact, like social work policy, like it says, like, do not tell parents, caregivers anything that could put the child in danger, right? Because as was shared in this present, we know the statistics. We know what our kids are going through. So it's exactly what you said. It's like it could put the child in danger. It's just it's never under mandated reporting or any of those things that people might think it's under, because it can put a child in danger, unfortunately.
In my
And-
local high school, the teachers have been phenomenal.
And that's what I find is people are worried about what they're allowed to do. So they just need to be told, you are allowed to do this.
yeah,
right?
they're phenomenal about using the name and as a parent, it warms your heart to know, young people are being supported.
And oftentimes, like what Cadence was saying, when a young individual comes to you and says, hey, I would like to use this name and these pronouns, the conversation starts there and then it can evolve. But again, like specifically for which, if you come to part 2, you'll hear some of my personal story. As a trans man, I was very much so out at a young age. And my parents didn't know until I was older with the dynamics that I, for a period of time, was disowned because they didn't accept me. And so as a young kid, being able to vocalize that to somebody gave me the ability to be empowered, but also kept me safe, because I knew that that conversation couldn't be had in the household at that time, because and I've known since I was 7, didn't have the terminology and so forth, but as a young kid to be disowned at a young age because that conversation possibly would have been generated to a parent, shows those statistics, the homelessness rate of LGBTQ plus individuals, as well as I've had conversations where teachers are like, well, the parent should know, or the counselor's like, the parent should know. And it's the same kind of dynamic of when I go into looking at when someone's exploring something, a subject or whatnot, and they're navigating that dynamic. There's already so much happening that then if you have all these other people coming in, especially your parents you're seeing you every single day, and the people kind of in the control base, there's a lot more pressures and a lot more tension that can be built on young kids to even navigate those expanding mindsets, that growth that they're trying to figure out and navigating what to do next. Because as a young trans individual, I was also opening up to 1 or 2 teachers and saying, hey, I'm only out to you because I, again, didn't see curriculum. I didn't see, as a young kid, any type of like inspirational people in the community that were like me. So I still was navigating self-doubts in myself, to then have my parents or caregivers or whatnot be like, are you sure? Do you think this is a phase? Like, and I had to deal with that in my young adulthood, in my late teens. And it was still very combative in a sense in that regard.
Well, thank you. Thank you for that information, all of you.
I got to share a funny story with you about getting your needs met. I know a family where the young person had changed the name, taken a new name, and the parents thought it was more like a nickname among the friends, and explained that, no, this is the name that the person is going to go by. And of course, the parents kept slipping back. And so what the young person did was just not answer them, acknowledge. And it took the parents about a week before they figured out what was going on. And they asked if that's why they weren't responding. Yeah. And that was a strong motivator. And I thought, that's one creative, resourceful kid.
Yeah, I
Thank you
can see
for-
now how this could be really empowering for a student. So thank you.
Yes, thank you for asking, Rebecca. And you did touch base on one of the topics that we will talk about in part 2, which is the continuum of coming out and what that's like, that experience. And Cadence and Ace, I'm so grateful to have you both here because they can talk more about, you know, the specifics of policies and what teachers can and cannot do and how they can empower their students and such. So thank you, Rebecca, for asking.